So we're with Amanda today. She's 35 years old, and we're going to do a restoration in her tear trough and orbital ridge area, very delicate procedure. And I'm also going to do the top part of her cheek to help lift that up. So, you excited to do your treatment today?
Very excited.
Okay, I'm going to first start by injecting some restoration in her cheeks. Here's a poke. It's really important when you're doing under the eyes that you give the cheeks a little bit of plump, and it helps to disguise the restoration under the eyes. So oftentimes people will forget the cheeks, and then you can see that delicate skin under the eyes show the product. So really important to give a little upper cheek restoration before we begin the orbital ridge. And today I'm using Restylane Lyft for the upper cheek. And then I'm going to use the classic Restylane along the orbital ridge. I prefer Restylane under the eyes because it won't draw in too much water. Very malleable, very natural looking, very forgiving. So I do prefer classic Restylane. Okay, so just like that, a little bit of cheek restoration to support what I'm going to do underneath her eyes. And Amanda, I'll have you go ahead and close your eyes.
Okay.
And now that the cheek is supported, I really don't need to do too much. Here's a poke. I'm just going to do a little softening. I don't go too heavy into the corner. There's some larger arteries in the corner. There's also tear ducts, so we do kind of keep it away from that corner, and I like to just do a nice straight pokes. Okay, here we go. 1, 2, 3. Going in there. Popping that out ever so slightly. It's a pretty comfortable procedure. Obviously there's lidocaine in the syringe. Amanda has been topically numbed. It is an area that you do need to prepare for possible bruising. Very delicate, a lot of delicate vessels in this area, so before you get the injectables, you want to lay off any blood thinners. So I always tell patients no vitamins, no Advil, Motrins, or Excedrins before you're having your procedure done. Here's a poke. Again, just slightly, ever so carefully popping this skin out right on the orbital ridge. This area you want to underdo it because the body will draw in a little bit of water, and so it's best when you leave the office that it is underdone, not overdone, giving your body a natural chance to bring in the water, which can take a few weeks. Okay, Amanda, I'm going to have you go ahead and open your eyes, and I'm going to check. Your eye may feel a little weird only because of the lidocaine, and that just takes about 10 minutes to go away. Alright, so need a little bit more. We can already see a huge difference between the right side and the left side. And a little check. Again, Restylane very malleable, so you can mold it. Amazing, looks great already. And I'm going to go and put just a tiny bit more. Go ahead and eyes closed. Go a little bit more right here. Here's poke. Okay. So just like that, this side is done. Typical results on this, because the under eye, we really kind of leave it alone. We don't mess with it. Classic Restylane can last up to a year. Beautiful. Go ahead and open your eyes again. And again, if they feel a little weird, that's just the lidocaine. It takes about 10 minutes for that to go away. So wowzer, that's a big difference. So I'm going to quickly show Amanda just her kind of right side versus her left side, and then we'll start the left side.
Oh, wow.
Isn't that
That
cool?
looks so much better.
Isn't that cool?
Yeah.
All right, good job. Okay. Okay, we're going to go ahead and start this other side. Again, going to first raise up the cheek. Here's a poke. Oftentimes the upper cheek is missed when someone's doing the orbital ridge, and it can really alter the final results. So it can leave people looking like they've got like a hot dog roll under their eye if you don't raise up that top portion of the cheek. It literally supports the skin on the orbital ridge. And do a little bit more. Oh. And if I do the upper cheek, then I need less product underneath the eyes. Okay, so there's the upper cheek done. Now, just like the other side, I'm going to go back in with classic Restylane. And do along the orbital ridge. Here's a poke. And if you're more comfortable, Amanda, you can close your eyes.
Okay.
I like to mold it. These injections are a little bit deeper, so it helps to disguise the filler. But sometimes the skin is very delicate, it's right along the bone, and so it's important that less is best, because you don't want to see the product. After a few weeks after you get injections, if you do see something, this is super malleable. You can mash it down. Here we go, here's a poke. My opinion, hyaluronidase to break down filler should only be used in an emergency setting and not just because somebody doesn't like the look. If you don't like the look, massaging is the best way to reduce down the filler. It will break it down. I tell patients, though, we won't do any sort of massaging or manipulating the product for a few weeks because it does take up to three weeks to yield final results. Looking great. Okay, go ahead and open your eyes. Yeah, it's amazing already. Okay, I'm going to do a little bit more, eyes closed. Here's a little poke. Very good. Total amount of product, we did a half a syringe up on the upper part of the cheek and a half a syringe of Restylane. And again on this side, half a syringe of Lyft with a half a syringe of Restylane in the tear trough on the orbital ridge. And there you go. Go ahead and open your eyes. Voila!